In a significant step towards strengthening St. Lucia's emergency response systems, key stakeholders from government and civil society participated in a two-day capacity building workshop aimed at tackling gender-based violence in emergencies. The workshop, held on May 26 and 27th at the Harbour Club in Rodney Bay, was co-convened by the UNFPA, UN Women, and the Government of Saint Lucia in partnership with the Caribbean Development Bank. Liaison Officer D. Jane Gibbons of the United Nations Population Fund for Barbados and the OECS highlighted the critical role of collective action amid the growing threat of climate-related disasters.
So the increased frequency and severity of climate-related disasters, such as the still recent Hurricane Beryl, combined with the persistent threat of gender-based violence, particularly in emergencies, demands strengthened, timely, and survivor-centered responses. Data consistently shows a spike in GBViE cases, making our work here more urgent and essential. At UNFPA, we are guided by three transformative goals: ending the unmet need for family planning, ending preventable maternal deaths, and ending gender-based violence and harmful practices. And this workshop falls within the third of those strategic transformative goals.
Director of Gender Affairs Janie Joseph adds, with global data showing a troubling rise in gender-based violence during emergencies, this moment presents a timely opportunity to prioritize gender mainstreaming and social inclusion in crisis response.
The composition of participants I see before me here, it reflects a shared understanding of the value of coordination and of all those sectors in response to GBViE. In the case of St. Lucia, we also included in the National Interagency Task Force for GBViE the education sector, recognizing the key role that the education sector plays, both in terms of response and particularly in terms of prevention. It does take the collective effort of all sectors, and I commend the health sector for validating this.
Chief Medical Officer Dr. Sharon Belmont George underscored St. Lucia's commitment to strengthening systems that provide a timely, coordinated care to survivors.
In St. Lucia, as we work towards the attainment of universal health coverage, we are cognizant that this global target is not possible without universal access to sexual and reproductive health services. The UNFPA supported service assessment of the essential services for women and girls subjected to violence in St. Lucia, and this was, I believe, in 2019, indicated that the existing services meet the criteria for availability and accessibility.
The training focused on gender-based violence in emergencies, social inclusion, and gender mainstreaming. It also marked the validation of St. Lucia's clinical management of rape protocol, a major milestone in GBViE response. During his remarks, the Minister for Health, Wellness and Elderly Affairs, Honorable Moses Jean-Baptiste, emphasized the government's dedication to reaching the most vulnerable and ensuring support is delivered with dignity and compassion.
When communities face the devastation of natural disasters, pandemics, or humanitarian emergencies, the vulnerabilities of women, girls, and marginalized groups are heightened, as we know. The threat of gender-based violence intensifies, making it imperative that we strengthen our response mechanisms with urgency and with care.
The GBViE training workshop marks a critical step forward in strengthening St. Lucia's health and emergency response systems. With healthcare providers, Ministry of Health staff, and key national stakeholders now trained and sensitized on gender equality, social inclusion, and gender-based violence, especially in humanitarian settings, the country is better positioned to deliver a more coordinated, timely, and compassionate response to survivors. From the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Onika McCoy.